I'm going to talk mainly about the situation where the baby is being born vaginally with the head first. Breech deliveries are definitely high risk for having a brachial plexus birth injury, but they're very rarely done in North America now, or at least like there are some emergency situations perhaps where that happens, but for the most part, um, the surgeons and the obstetricians and everyone who delivers babies, they do not tend to deliver breech. So the vast majority of the children that we see are delivered head first, and this is a picture showing a normal delivery where the baby is being born head first, and the head comes out, then the shoulders come out, and then the rest of the baby comes out. Okay, we can advance the slide. However, in certain situations, either the baby is too big or there's a mismatch in kind of the baby size and how they're lying in the baby's tummy, and the mom's pelvic outlet where the baby has to get through in order to come out. And the shoulder can get stuck on the pelvic bone either in the front or at the back. So in this picture, the right shoulder of the baby is getting stuck on the pelvic bone in the front. And that is a situation called shoulder dystocia. Shoulder dystocia occurs in almost all of our babies who end up with a brachial plexus birth injury, but you can have shoulder dystocia in the absence of the nerve injury. So basically, when the baby gets stuck on their way out, it becomes somewhat of an emergency. The baby cannot breathe when they're stuck halfway out, coming out of the birth canal. And so their lungs are compressed. They cannot breathe. And for many of the moms who've been through this and the dads who have witnessed this or other partners who've witnessed this, it's a very stressful situation at the time. There's lots of people that come into the room. Sometimes they call a code pink because they can't get the baby out. And there's a variety of maneuvers that may be done, including pressing on the belly, changing the position of the mom, using forceps or using a vacuum or manipulating the baby. There are a number of maneuvers done to try to deliver the baby because, again, the baby's not breathing well when they're stuck in the pelvic outlet. So that can all happen in the absence of a nerve injury, but sometimes as a consequence of shoulder dystocia, with the shoulder being stuck in one position and the head is coming out the other position, you can get that stretch injury that Erin talked about in the brachial plexus in the neck. And that has a significant range of severity. So we see very mild stretch injuries that get better in within a few hours or a couple of days. And then we obviously have the more severe injuries where the arm is not moving at all after birth and doesn't recover at all on its own. But that is, in general, the mechanism by which the nerves in the brachial plexus are stretched. This occurs, so brachial plexus birth injury occurs. So these are another, so just go back for a second. Yeah, so this occurs in about 1 to 3 per thousand live births. And that's pretty consistent in most of the developing world. And it occurs in about 4 to 15% of all babies who have experienced shoulder dystocia during the time of delivery. Okay, so we can go to the next slide. So this is just another diagram demonstrating the same thing, where the baby is getting stuck on the way out. The shoulder gets stuck behind the pubic bone. And on the left, you have the one where it's getting stuck on the front, but on the right picture, you see that the other side is the part that's getting stuck on the back of the pelvic bone, and that's where the nerve can be stretched on the other side. So it can happen on either shoulder depending on the orientation. So we are not, none of us are surgeons that deliver babies, and we are not experts in the delivery of babies. But obviously, because of what we do and our passion for caring for children with brachial plexus birth injuries, we are obviously very well read on what causes shoulder dystocia, what is known to cause brachial plexus birth injury. So I wanted to just touch a little bit on shoulder dystocia just to better understand what are the risk factors. So there are several known risk factors. So I mentioned earlier having a big baby, and that has a few definitions. It can be over 4.5 kg. Other people have described it as over 4 kilograms. Um, Being past your due date, that also leads to a bigger baby. So the longer you are, if you deliver at 36 weeks, your baby's going to be smaller than if you deliver at 41 or 42 weeks of pregnancy. Diabetes, in the mom, whether it was pre-existing or occurred only gestationally during the pregnancy, can lead to the baby being bigger. So that's also a risk factor for shoulder dystocia. Mom's weight is also important because that can also lead to bigger babies. Older moms, for reasons that aren't very clear, having had a baby with a prior shoulder dystocia or a prior brachial plexus birth injury will increase the risk of having another baby. And in general, the babies tend to get bigger with each progressive pregnancy. And then the use of vacuum or forceps extraction when the baby is still very high up and the head has not come out yet. So those are known risk factors for shoulder dystocia, but still, when you look at all of the babies that have experienced shoulder dystocia in the mom, these risk factors only explain about a quarter of the cases. So there's still a lot that we don't understand and the medical community doesn't understand in terms of why shoulder dystocia happens and how it can be predicted ahead of time. Okay, you can go forward to the next slide.